CBS News Miami is taking a close look at kids in crisis. It's part of our commitment to helping you and your family cope with mental health issues. Imagine having a child saying they want to end their life, or your son or daughter feeling so down they don't want to leave their room or go to school.
It's a common picture in many homes, and it's forcing families to flood South Florida emergency rooms. CBS 4's Joan Murray found that while there aren't enough doctors, hospital beds, or therapists, there is still help and hope. You should know this story includes frank conversations about the mental health crisis that for some might be difficult to hear.
For Mariah Lemke, navigating the path of her life hasn't been easy. The road bumpy and full of hard turns.
I grew up in a predominantly white Hispanic neighborhood, so being, virtually the only black girl there, it put a target on my back.
Starved and neglected when she was a baby, Mariah was adopted at 4 years old. Beth Morgan is her mother.
I understand depression. I understand it even more now. But at the time, it just felt like things were happening and I just didn't fully appreciate the severity of it.
Mariah said through elementary, middle, and high school, she was laughed at, taunted, belittled just for being different. A rare hereditary disorder affected her walking and hearing. Happy, strong, and resilient on the outside, inside she was sad, helpless, and crumbling.
I just wanted to get rid of all that pain that I was feeling. I felt so alone.
Desperate, despondent at 15, she went to her bedroom, swallowed more than a dozen antidepressant pills, and said goodnight to her mother.
At that moment, I said I love you because I didn't want to end.
Thankfully, Mariah Lemke's plan failed. Instead, she ended up here at the emergency room of Nicklaus Children's Hospital. It was a turning point.
And Mariah actually got the very last bed in the unit that night, which meant that she could stay here. And that is a testament to, the fact that there's so much problem that the entire unit was basically full.
The unit is still full, and increasing numbers of children are coming through the ER.
So currently we have 20 inpatient psychiatry beds.
Dr. Marcos Mestre is Nicklaus's chief medical officer.
Usually we have to transfer out because we're full about 300, 350 patients. And in 2021, we saw a spike up to 700 patients that we had to transfer out. And many of those about half of those having to go across county lines.
A lot of his emotions were rooted in sadness and anger.
This mom of an 11-year-old who took him to Nicklaus in January asked not to be identified, but wanted to share his story.
And he made a comment that was a self-harm type of comment.
That comment, IMAKMS, which stands for I'm going to kill myself. Frantically, she started calling psychiatrists.
The majority of the offices were telling me, we're so sorry, we have no availability until May or possibly June.
Wanting not to wait, she heard of another way. Through a pediatrician's referral, she took her son to the ER, where they stayed from 9 at night until 4 in the morning.
And they had to scan him up and down like you would see going through airport security. That was a little unnecessary, in my opinion. And then just the environment of the room, it was white, it was sterile, it was not warm and inviting for a pediatric psychiatric unit.
Dr. Mestre explained there's a reason for the Stark unit.
We have to make sure they're not carrying anything on them that could cause them to hurt themselves.
So this is your unit. When we went through the mental health unit at Joe DiMaggio in Broward, we found a similar setup, basic rooms with the bare minimum.
We're seeing almost double the number of children we had seen before, and they are presenting, almost 60% of them are presenting with thoughts about suicide or suicide attempts.
Like Miami, the number of children coming to the ER is staggering. Here's a breakdown year to year over the first quarter. January through March 2020, 259 children. 265 in 2021, and in 2022 it more than doubled, 568 children in crisis.
Suicide is actually the 8th cause of death in children between 5 and 11.
Dr. Celine Hamilton, head of the Children's Psych Unit, explained Joe DiMaggio has 12 beds, but they can expand when needed.
I would say in child psychiatry and children's mental health in general, there are not enough providers.
The crisis is linked to the isolation from the pandemic, dependence on social media, and children wrestling with returning to normal after COVID.
They are being pressured to send pictures of themselves over text. They are failing their classes. They are in breakups. They are having all sorts of different experiences that lead them to come to the emergency department.
This mom's son is meeting virtually with a psychiatrist. He prescribed a low-dose antidepressant, and they are figuring out when to resume his ADHD medicine. She said she found that doctors prefer self-pay.
That psychiatrists, by and far, are not interested in dealing with insurance companies.
After her hospital stay, Mariah Lemke was put in an intensive outpatient behavioral program 3 times a week for 4 hours a day.
What helped you the most?
I think seeing other kids my age really made me feel connected and just grounded, where they also went through the same thing I went through.
Mariah has finished high school. She's enrolled in college and wants to be a writer, the hero of her own story.
What would you tell others going through what you went through?
But there's always hope, that just because you're going through a really rough, depressing time right now, there's always going to be something better for you. And it's just the storm before the rainbow.
Hospitals are aware of the crisis and responding. Nicholas is adding 20 hospital beds by the end of the year. In Broward, the Memorial Healthcare System is creating a behavioral treatment program in conjunction with Joe DiMaggio. In Miami, Joan Murray, CBS 4 News.
I like how she put that, just the storm before the rainbow, after all she's been through.
How fortunate that there was that one bed available for her. Things could have been so much different if there hadn't.
And we hope all the kids who need that help can get it
and
as
there's
well.
more of it coming.
And if you or someone you know is in crisis, get help from the Suicide and Crisis Lifeline by calling or texting 988.